You must see, I mean, how many patients a month? In the hundreds?
Yeah, we're getting up to almost, yeah, in the hundreds, if not a thousand.
Wow. Well, what is the biggest overall concern or worry that your patients are sharing with you when it comes to fertility and using telehealth and at-home testing? And how do you kind of ease
Hmm.
uh, those anxieties?
Well, we don't really see too much concern or dissatisfaction with the telehealth platform. I think uh, people have adapted to it and feel very comfortable because, in their professional lives and personal lives, the vast majority of people spend a lot of time in front of a screen. So all they do is just, um, yeah, exactly. And so the addition of medical care to that repertoire at this point is probably second nature. And so we don't see a lot of concerns specifically getting their care delivered this way. There's, people are concerned about the potential of the accuracy of the at-home testing. There's some concerns about the survival of the sperm with regards to at-home collection. But for the most part, people are very accepting of this process and are very willing to proceed with telehealth and at-home testing if that's what we recommend.